have a different venue for today's, instead of up in the library, down in the parlor instead. So
yeah. And what's most amazing about that, Nabila, is you have some of the most incredible art throughout your home. And so by being in a different place each week, we get to see some of those snippets. So I do love that as well.
Yes, beautiful art, beautiful art.
This is actually a really interesting triptych that Sadia Okeli did. And, you know, when you look at it, it looks like blossoms or cherry blossom or something like that. And it turned out that she did it when her uncle was going through chemo. And actually, it was, she saw a photograph of his platelet count. And so what it actually is, if you take a closer look, it's, you know, sort of like clumps of platelets that she has stylized into this. Yeah, I thought it looked like blossoms. I loved it, but it's actually a triptych of blood.
Wow.
So there you go. While I'm waiting for people to join, I am going to go get a hot water bottle for my back, because I went for a social distancing walk with one Eric Wilkerson at this lunchtime, and my back's a little stiff. So I'm going to get a hot water bottle, the good old wives' remedy, and I'll be right back while everybody's joining.
Hey, did anyone else have trouble finding the link? No.
No.
Good, just me.
But you're here on time, so you did it.
Well, I guess it took me 2 minutes to find it.
Where did you end up finding it, Anna?
An old text message.
Gotcha. Okay, we've been posting it in the Facebook event, but it might be getting buried or something. So I'll make note of that and make sure it's really visible and accessible for everyone.
Thanks.
Hi, Anna. Hi, Jason.
Hey. Hi, everybody. Hey, book clubbers. Hey, Devin.
Hey, Teresa.
Yes.
Hello. Devin, so David is confirmed for the 21st. Do you remember who is confirmed for next week? Is it Victor?
No, I don't believe we have anyone for next week.
Okay, so we can talk about that tomorrow. Yeah, okay, because I looked on the book club plan. I didn't see anyone there. So, okay, so we can talk about it tomorrow then.
Sure, yeah.
During our catch-up, okay.
Well, should we go ahead and get started? Is everyone ready?
Sure.
Yeah, that sounds great. So Nabila, what do you, I'm happy to, would you like to give the overview of the book summary?
Sure.
And I'd be happy to do a brief intro to Aisha.
Yeah. So, very quickly, we, as I said last week, it felt to me like if a book has, sort of like an arc or a curve, I think last week was that crescendo that we were waiting for, because there was, sort of like that sense, there had been that sense of foreboding, and I think that sense of foreboding came to fruition last week. And so this week, what we've been dealing with mostly is the fallout and the aftermath of that. And so in terms of what is happening with Fiona has found her daughter's boyfriend, and it turns out that her daughter is in Paris, and she has a granddaughter. So she sort of like, I love Fiona's doggedness, sort of like she just kept at it and kept at it. She has found her daughter, also found a granddaughter who happens to be called Nicolette, which she's not brave enough just yet to ask her daughter whether she's named after the uncle that she didn't know. You hear that the day on which Claire was born, Fiona said that it was the worst day of Fiona's life, and Claire took that statement, and it was like a defining arc for her life up until now, that rejection or that unwantedness. Meanwhile, things are moving along for Yale. He, sort of is coming to terms with the fact that he has been exposed. He is, things are still going great for him in his professional life, in as much as everything that Nora said was going to pan out has actually panned out. Sort of like these Modiglianis and all of these art pieces are actually, it appears that they are authentic, and sort of like there's more in that story that is starting to unfold. Interestingly, we are introduced or interestingly for me, we're introduced to the fact that she, sort of like she had gone away from, well, we knew that she came back to the United States because of the war. But when she goes back to Paris, it is in the midst of the Spanish flu pandemic. And so here's another virus that's sort of like introduced. So that discussion follows through. And what else? I love Yale. I think he is, sort of like, yes, he's angry at Charlie and he doesn't know quite where to put his anger at Charlie. But the fact that he is, a good and decent man and a decent human being, plays out when he sees Julian. And, sort of is, ultimately he takes Julian in and is forgiving of Julian and takes him into where he's saying. So where we ended last week was Yale had been thrown out, or not thrown out of, but he found that he could no longer stay with Cecily. But it now turns out that he is in the Corncob building, because the benefactors of Northwestern also have a downtown building, and they've let him stay there. So that kind of summarizes back and forth where we are, I think. I don't know if anybody else had anything else to add to where we are in the book. Oh, yes, the shuttle, sort of like exploding, and where we are politically in the political arc.
That's a great summary. Thank you, Nabila. This was really, really good reading. Again, like I said, the book is a page turner, but looking forward to diving into the discussion. We have a good groundwork laid for some of the things that we're going to be talking about in terms of stigma and shame and race and HIV. And really excited to dive into the discussion. We are so happy, book clubbers, to have our guest with us, Aisha Nicole Davis. So Aisha is wonderful, wonderful person. She does so many things in the city. In addition to being just a fierce advocate and a lover of science fiction, she also is the director of policy at the AIDS Foundation of Chicago, and it's totally rocking that role. And she also happens to be a dear friend of mine and someone I have tremendous respect, admiration, and appreciation for. So I am so excited to have her join us as our special guest tonight in our conversation. So much love, Aisha, and welcome to the book club.
Thank you. Thanks for inviting me. I'm so excited to be here and hear the discussion. I haven't read the book, but it sounds riveting. So I think that I might have to buy it after the end of the conversation.
It's all good. And as a matter of fact, one of the reasons why this book is so great, as Nabila and I have shared before with others, is that the conversations are theme-based. So it's not a book club where we are only talking about specific details in the book. We also have, we use the book as a basis for a broader conversation about things that are happening in our city and LGBTQ communities, family, love, loss, all of that kind of stuff. So no worries about that.
The other reason I'm sitting down here is I'm hoping that my two new kitty cats are going to come and introduce themselves. They're like floating around. They're wandering around all over that, you know, behind me and everywhere. And if you're Facebook friends with me, you will have seen my morning post this morning. Which
I love that post.
waking up with face full of pussy. Yes, that's what I woke up with this morning. I know, Jason. Yeah, there you go. Anyway.
That was fabulous.
She's so cute. She's been back here, but she's gone that way right now. You know, I do want to bring Aisha into this, and let me take a step back, Aisha. One of the things that has been a theme throughout the last 4 or 5 weeks has been you know, sort of this notion that, you know, sort of like HIV/AIDS, back then it was very much, you know, the face of it was a very white face, a very Western white face, even though, you know, in the rest of the world, people of color were succumbing to the virus just as much, if not more, and entire villages and entire, you know, we talked about this a couple of weeks ago about how there's an entire village in Pakistan that is completely decimated, and every single individual in this entire community is positive. In this book, and it's set in 1985 and 2015, and in both time frames there's very little in the way of discussion of communities of color and how communities of color get left out, pushed aside, you know, I mean, I've been writing today about, you know, sort of about the young man that was running, and, you know, sort of like just now the New York Times has put out that, you know, sort of like the prosecutor, the DA, you know, sort of didn't take up the case because one of the shooters was part of the DA's office or something like that. So I want to bring the conversation into, if I may, into a discussion of race and a discussion of how our communities have been neglected, how our communities of race have been neglected in these conversations, and if we are to learn from, you know, sort of like what's happened in the past, what do we do? What measures can we take, or what, even, you know, even if there's only one take home or takeaway, an active action item, what would it be? I don't know. I mean, I know that's a really broad.
That is, but it's also it's really interesting, because I think that a lot of times when we think about what the face of the HIV epidemic or the AIDS crisis of the 80s was like a cis gay white man, right? But I feel like there's a similarity in terms of the general face of the LGBTQ community for a long time was the same face. And there was a lot of correlation between HIV and being queer. And, you know, I remember growing up and hearing people talk about it as a gay disease. And so there is this stereotype that kind of went hand in hand in terms of who the face of both of these different groups were. And now I think that we're seeing not just that the statistics are showing that more diversity is happening in terms of like representation in queer communities, but also in terms of focuses for organizations like AFC, where we're looking at trying to end the HIV epidemic, and we have to focus on the communities that are still being hit the hardest. There is this, I guess, general understanding about what HIV is in like the general American's like mind, but I don't know that people are considering the different ways that access to health looks across the country and what that means for different communities. So for example, like let's just take Chicago. In Chicago, there are a little, like about 23,500 or so people who've been diagnosed with HIV. And I believe that that statistic is based on a number in 2018. So it's, at that point, it was about 23,500 people living with HIV in the city. Then, because we know that the CDC says that a lot of people living with HIV, or not a lot, but a fair number are not diagnosed, that means that you have to add in a buffer number to kind of guess at how many people are living with HIV who are also undiagnosed and diagnosed, right? So if you combine all the numbers and we use that buffer percentage from the CDC, it's about 27,500 people in the city of Chicago living with HIV. In Chicago, we have access to so many different resources, right? Some neighborhoods have more resources than others. Some folks know about resources that are available for people living with HIV. Some people don't. But even in the most neglected communities of Chicago, there is probably a space that someone can go to within a 15-mile radius that can provide them services specific to living with HIV. When we go further away from metro areas and we start thinking about this rural city divide that exists, there is less competency, there are less conversations, there's fewer attention being paid to what living with HIV means, how HIV is transmitted, all of these different things. And we know that sex ed in schools isn't necessarily bridging that gap either. So I think that there is a conversation that has to happen that's about the geographic divide, the racial divide that exists, the divide in resources that exists within a specific geography. So there's so many layers to it. And I think that across all of those layers, we have to be sensitive to the way that like stigma and these assumptions really resonate in different conversations. So if the face of HIV has been a cis white man for, what is it, going on 30 years now, we have to remember, that that's just a stereotype. Because when we look at the statistics, it's actually around, for people living in Chicago, about 50% are Black who are diagnosed with HIV. And then about 20% are Latinx. So that's 70% of people who are not white, you know? And so for the face of this conversation to still be a cis gay white man, it's not only doing a disservice to the conversation around how to end the epidemic, it's doing a disservice when we're thinking about how we allocate these resources, what neighborhoods we need to be going to, what communities we need to be bringing to the table. And that's not to say that we turn away from any one community, right? It's that we bring more communities into this conversation. Because the last thing that we want is to try to cut off a resource stream and redirect it to another group. And then you just see it flare back up in that other group who's now under-resourced. So the goal really is to make sure that the resources that we have available are shared amongst communities, and that we're really getting that kind of a global net, if you will, of resources being shared with people. And if there was one takeaway, oh man, it's hard. I feel like before the pandemic, I would have had one answer, but like right now, I think it's a different answer. Like before the pandemic, if you asked me what the one takeaway would be, it would be that every organization that is dedicated to working with people living with HIV, whether it's central to their mission or not, they need to make sure that they are taking a significant step back away from what they've been doing and looking at how to incorporate more conversations with people of color, especially Black and Latinx people. And if you were a group that was already working with those two communities, then just make sure you tap the other organizations that weren't and bring them with you to those tables. But now that we're in the midst of a pandemic and we don't have the same freedom to move, and I don't want to say that as like, oh my God, we're not free and we have to reopen the state. It's nothing like that. I'm saying we don't have the safety that we need to gather in large spaces the way that we used to, right? Like it's easy to have a town hall where you bring people together and you educate them and then you let them go out and share information. We don't have the capacity to do that as much anymore. And the last thing that we want to do is try to pull a bunch of people together to educate them on something while being ignorant of the pandemic that's existing right now. So I think the big takeaway now would be to just make sure that you are aware of the ways that you can help support people who are living with HIV. And that support can look a lot of different ways. If you're somebody who is more inclined to be activist leaning, that can be calling your representatives, asking them to make sure that they support all of the bills that support funding for HIV resources, whether that's through healthcare access or funding organizations specifically working with people living with HIV. If you're someone who is just full of all the compassion and has the capacity to reach out to people directly, call people up. I know that there are a lot of organizations who are seeking volunteers, especially to reach out to older people. And there are a lot of older people living with HIV right now. Back when the epidemic was at its height in the 80s, the thought was that HIV was a death sentence. We have people living with HIV who are in their 60s, 70s, and 80s. So if you know that there's someone who's older, or you know of older community members, reach out to them, because I think one of the biggest takeaways that I've been hearing lately is that people who are in assisted living facilities are feeling extremely isolated right now. So I would say reach out to those people especially. And then, you know, if you are someone who doesn't know necessarily who to reach out to, you don't have the capacity to make those calls, but you do have the financial resources, donate to organizations that are right in the community who are serving the people right now who need access to resources. We saw in the last Federal CARES Act bill that there was additional funding allocated to resources related to people living with HIV. So there was, well, not the CARES Act, I'm sorry. The act before the CARES Act, the first larger federal stimulus package, in addition to the CARES Act, they both included some kind of funding for organizations. But the concern is really how far-sighted or how forward-looking those decisions were in terms of funding allocation. So the first assumption was that, oh, we can flatten the curve in a few weeks, it's fine. This is not the case. We're seeing that right now. We don't know how long we're going to be socially distancing. Even if things, quote unquote, reopen, there's still a lot of people who are very nervous, who are at a higher risk of contracting COVID-19, who still need to like practice distancing in a more serious manner. So there's more funding that's going to be needed for people who are now like at risk of losing housing, who are at risk of losing jobs, whose healthcare is now in jeopardy. I know that there have been some conversations around having a special enrollment period for all people who are uninsured as a result of COVID-19. So just staying aware of the things that are going on, reaching out to elected officials, talking to the people in your community, and really just, you know, when we think about the stigma that's associated with HIV, if you are compelled and like you feel your heart being tugged at by this narrative in this novel, there are 27,500 more people in the city who have some kind of narrative that's similar. And just let that be like a driving force to you, to remind you that, you know, every one of us is born with certain attributes. As we get older, we develop certain things. There's no other disease that is stigmatized to the level of HIV. We have criminal laws that can imprison somebody who didn't necessarily disclose their status before sex, or just couldn't prove that they disclosed their status before having sex with somebody. So thinking about it like that, just remember to encourage humanity and the thought of really understanding that a person is not a diagnosis, a person is a person, you know?
Yeah. Oh, that's a great line. A person is not a diagnosis.
Yes.
My fear with I'm sorry, Kelly, I didn't mean to interrupt.
No, you didn't interrupt.
My fear with this current crisis is that we are going to regress, and I think that these vulnerable communities, which actually, if you know, sort of like as I started out my question, you know, they're communities that we typically don't look at. They're over there. They're over there, or they're, you know, sort of. They're going to sink farther back into that gray space and into that ignored space, and that's a really significant fear. And there's too much else going on that's an easy trap and an easy pitfall for people to fall into. And then on top of that, there is, you know, in certain communities, this idea that, you know, sort of that HIV, you know, sort of like is a gay person's disorder, a gay, you know, it's gay people that are living with it. That's not necessarily true. There are, you know, sort of the idea that a man could have sex with a man and yet still be in a normal normal heterosexual relationship. I didn't, that normal wasn't meant to be in there, that word, as in a straight relationship. That, and then pass on the disease and pass on the infection to, you know, sort of like women that, and that is how they, you know, women get AIDS to, was that a sentence in this, or was that a sentence in this week's reading? Was it that women are getting infected as well? I think that was a sentence from the book. You know, that's always going to be an issue, and it's always going to be an issue that we end up, the vulnerable communities become that much more vulnerable in a time of crisis. And it's just, you know, it's like people have to keep pulling back at that.
Absolutely. I mean, if you look at the statistics around this pandemic right now, you'll know that the demographic that has the highest mortality rate are Black people. And then in the state of Illinois,
Yep.
the demographic that has the most positive tests are Latinx people. So in both of these categories, you see these communities of color that are being impacted significantly. And the flip side of it is that I realized when someone said this, and I think that they meant it as a joke, but they were saying that women have a higher survival rate for COVID-19. So it's like a way, they were trying to make some kind of offhand joke about it. But in my mind, I'm like, I hope that this doesn't travel too far. Like, I don't want this information to get out, because my fear is that if there's this assumption that women can recover better, that there will be less care given to women. And as a Black woman especially, that's something that I'm fearful of, because we already know that the maternal mortality rate, the diagnosis rate for Black women, especially around a lot of different illnesses, is higher, because either the professionals aren't listening, or they're rushed through an appointment or something like that. So it's really concerning. And I agree with you, like the communities that have been under-resourced and underserved are feeling the highest impact right now. And it's something that, like, as somebody who's worked in policy for a few years now, it's something that's really frustrating, because it's not new. It's not new information, right? If we had to sit down 5 months ago and think about what neighborhoods had the lowest access to healthcare, the most under-resourced public schools, the worst public transit options. If we sat down and mapped it, we would know exactly where it was, and those maps would overlap with the communities that are being hit the hardest by COVID-19. And then on the other side, there have been people who are like, oh, people who've dealt with the HIV epidemic, it's going to be, you know, they're going to be the experts in COVID-19. And there was this way of talking about it as though the HIV epidemic is past, or that we're at some point where we're like about to cross the finish line. But that's not the case. Here in Illinois, we have a Getting to Zero plan that is through 2030. There's a whole decade of work that we have to do. We're not near the finish line at all. And my fear is that the stigma that is impacting people living with HIV right now, and people vulnerable to HIV right now, will be mirrored in the way people treat folks who have either been diagnosed with COVID-19 or who are assumed to be at higher risk for having COVID-19, right? I was listening to a call the other day where someone was saying that insurance companies may start to have a question on their questionnaires about whether you've been diagnosed, or someone in your family's been diagnosed, or anything like that, as a way to either increase people's premiums or kind of weed out people for having pre-existing conditions. You know, like it's that kind of a level of thought that has to go into it and be concerned about. There are some municipalities who are trying to share information about people testing positive for COVID-19 before first responders get to them, so that someone knows about your diagnosis before they even see your face or address whatever issue you're facing. And that's problematic too, because again, you come in with these assumptions, or you might treat someone differently because you know of a certain diagnosis. And we see that with people living with HIV already too. And there's not a far step from having people like pre-disclose your status on something like that to going to criminalizing, people who are being impacted by this pandemic. You know, we've seen people being harassed and targeted for not having masks on. We've seen people harassed or targeted for having masks on and being the wrong shade of brown. You know, so there are all of these different nuances and complexities that exist in this conversation. And really, I think at the end of the day, there has to be more compassion and humility and humanity expressed. We can't walk through the world assuming that, you know, this person, like if I assume that I see a like straight person, that they won't ever be impacted by HIV, right? And I also can't assume that if I see a white person, they're not impacted by poverty, or if I can't assume that, you know what I mean? Like, we can't assume that all of these issues look a certain way. We have to be willing to learn and listen to people and their experiences, because no two experiences are the same.
Yeah. And that's actually, that's what you set up talking about, sort of like what the stigma and the impact that that stigma has on a variety of communities, not just individuals, but certain communities, especially communities that are the hardest hit. That's a great, I would say, an entree to invite everyone in the book club into the conversation. So for example, Sonal said that what's happening with COVID-19 is actually shining a light on real systemic issues that have always been there, but how this pandemic is being handled, how it's being talked about, who's being neglected and who isn't, all of that is shining a light on the real fractures and discrimination and under-resourcing of in certain communities. So I think that that's true. To your point, it's nothing new, but it's shining a light on this. And so I'm really interested in getting people's reflections and thoughts on this theme, actually, that, or not this theme, but these issues, or reflections on anything that you read that is kind of in alignment with what this theme is about, and a lot of the excellent points that Aisha has brought forward. So feel free to dive in, y'all, if anyone has anything to say.
I often feel overwhelmed by, issues surrounding, I don't know, any kind of, just general unfairness. Why was this person born that way, that person born this way? Some people, I don't know. But for the past 3 weeks, I've been volunteering, and I go in and out of doing volunteer stuff. I feel like it should be like exercise, like it's like something you have to just make time for and whatever. But a lot of times I just find that it's like so disorganized, or like things are more as weird stuff is expected of me, from me as a volunteer sometimes, like just like weird requests, like, actually, can you show up 45 minutes earlier than you normally do? And I'm just like, and then I just feel like sometimes when things are like disorganized, they like kind of fade out, but then like the guilt starts to build up again over time, and just back and forth all the time. And I don't know, just like a real world experience for me.
Mm-hmm. I think there's a lot to be said for like self-care in volunteerism as well. Thank you for sharing that. I think you have to be in a space and mindset and mind frame that is, I'm in a good place. It's only when you're in a good place that your volunteerism then is effective. I mean, if you're coming from a bad place or a place where there isn't self-care, so you've got, what is it, that thing that they tell you on an airplane, sort of like when the oxygen mask,
secure your mask first.
Your mask on first. Yeah, that's it. So that's what comes to mind when you say that. I wanted to bring up, if there wasn't any, I'm just looking at all of the people on my screen, and it says my connection is unstable. So if you guys can't hear me, let me know, and I can always move back up to the study. I read yesterday a rather disturbing article in one of the science journals that, sort of like, and it was a how do we go about getting back to work? And one of the science journals is suggesting something along the lines of an immunity passport. So essentially a card that would be stamped with, right, Aisha, that's why I'm throwing it out there, because that is, to me, that is like wearing a brand, and so So this, what made me think of it was your comment about the insurance companies and the questions and the questionnaires that they could put out there. It is a horrifying thought to me that in order to get back to a full workforce, we may end up having to have some kind of wellness or fitness to work hard, because the opportunity for abuse in that, the opportunities plural for abuse in that system would be so huge and so scary. And I just, I don't know if anybody wanted to comment on that, but immunity passport, that's being floated around.
That is so stressful to think about. I mean, on so many levels, right? So as an attorney, that bothers me for reasons because of just like the amount of disclosure that has to happen, what body is governing this, what type of corruption might exist in that body, how do you prevent that? What does the testing look like? Is it free? Does it cost? Like, who's paying for this? There are already complaints from insurance companies that they don't feel like they should have to cover treatments related to COVID-19. They should only have to cover the testing. And I'm just like, how do you expect people to live? Like, just telling them they have COVID-19 and then telling them, okay, now you figure out how to pay to survive is almost a death sentence for people who don't have the funds available to pay for healthcare like that. So having this idea of like a card or like a immunity passport, it's so many red flags. And then on the other side, the non-lawyer, but like science fiction lover side, I'm like, this is the first step. This is it. Like, this is how we like spin out into all the dystopian futures. It starts like this. It starts by like tracking people in this way and figuring out how to like designate who is good and who is not. We've seen things like this play out, and it doesn't even have to go to science fiction, right? We've seen it play out in history before. When you start designating people and labeling them based on identification, it never goes well. It never goes well. And all it does, it either leads to genocide flat out, like just straight up genocide, or it leads to such heavy discrimination and oppression that it creates a caste system that no one will be able to crawl their way out of if they're put at a lower rung. I'm sorry. Now I'm all concerned and like flustered.
I'll send you the article.
The thing, Aisha, that it makes me think of, in agreeing with you completely, is it makes me think of how voter ID laws, which on their face seem very, very neutral, but like they're used to systematically exclude people of color, people, like these communities that they're like, oh, well, you should just be able to have a driver's license, right? That's free, but it's not free, and it's not equally distributed, and there's a million barriers to getting it that people of privileged position don't even think about or recognize as barriers. And it's used as a systematic tool. And then saying, oh, you need your phone to show that you have COVID antibodies. That's just one more way to, it sounds so neutral, but it's really used as a systematic tool to like hammer at communities.
Absolutely.
I think the way that we think about disease, and the complete lack of empathy and the status quo, because that's what we were talking about last week, Nabila, too, where it's like, if I got coronavirus, I would not tell my mom. I would be like, I'm fine. And I would lie and be like, no, that's a smoking related cough. Not that I'm smoking, like the fear that it would put into her, would just be like, so it's not like, we're not even allowed to. And I was on the phone with Anna, and I feel like I need to admit this, that within the last few years, I met somebody who was HIV positive, and he told me, and I felt like, don't have sex with this person, which is like, I'm considered super open-minded and very nice. So these are this is programmed stuff into us. So it's like, how do we even have conversations where it's like, disease is part of healing? And we would always say that, like, if people want to go to India, they're like, oh no, I don't want to get sick, but you don't tell them that you'll get better, and that being sick is not something to be scared of. It's part of the system, is always in the state of dissonance and harmony, and it's like, we can't even tell each other that we're having a headache because it's like, well, here's all this medicine, here's what you need, you know, like lie down, what's wrong with you, what did you do that you have a headache, that you messed up.
But it's that stigma, and I think, and Aisha said this right at the beginning. HIV/AIDS, I think, is the single most stigmatized disease, and then on top of that, you look at the you know, before the triple therapy was available, you look at like how desperate the last days of the patients were. It's gut wrenching, and I guess the COVID-19 has come to some extent, scratched the surface of it a little. But there was maybe it was in the New York Times yesterday, day before. I think Michael Herman maybe posted this article where there was a doctor who was on the front lines of HIV treatment back in the 80s, and who is on the, sort of like near the front line with COVID-19, and again reiterated, no, you don't get it. It was a lot worse. It was way worse with HIV because of the stigma associated with it. And even today with COVID-19, the stigma with COVID-19 is not as horrifying as the stigma, or not as big, not as huge as the stigma with HIV/AIDS.
No.
I think it's hard too, because the idea and like the way that the stigma was so easy to, I guess, plant and like nurture for HIV was because it was easy to point to queer people and say it's them. Yeah. It's their issue. It's not us on this side. It's over there. There's not the same distinction with COVID-19 at this point. And that's the other thing, right? We don't know what this is going to look like, right? Because we know who is considered an essential worker and like the people who are celebrated, like doctors and nurses, and like the frontline workers like that are first responders. But we're also not thinking about the people who can't not work, right? The people who can't work from home, the people who are in these processing plants and the manufacturing plants where 50% of the staff are testing positive for COVID-19, but you still can't skip work or you're going to get fired. Like, there's still all of these different layers that are playing out right now as we're just like breaking into the first few months of having a serious pandemic in the US. And I don't want to be a pessimist about it at all, but it's kind of difficult to not be in this moment, because my concern is that we have enough people who have been either able to work from home or able to isolate themselves, and so they haven't seen it as directly or as close as someone who is still in these like manufacturing plants, in these centers, these processing plants, working for all these huge corporations, right? Not everyone sees that. And no, I don't think that people will see it. And I don't think that they want to see it either, because if you make people look at just how devastating this is and how easy it is to kind of say, let us go back to work. That's the thing that upsets me the most about the protesters, right? It's not that they want to go back and like work in an Amazon factory where they have to stand on their feet for 18 hours, right? They want people to go back to work so that they can get their Amazon Prime deliveries in 2 hours. They want people to go back to work so they can get their hair cut at the salon they want to go to. Like, these are people who are receiving services demanding that the other people who have to provide the services go back to work. And that's the conversation that people don't want to have and don't want to think about. And that's the thing that's frustrating, because it's creating this this class divide and this like service provision divide where people are saying, you know what, yes, your health matters, I guess, but what about my comfort? What about my ease of living? What about my expectations? What about the lifestyle that I got comfortable with before the pandemic? How do I get back to that quickly? And it's so frustrating to think about that, because it just lets you know that people seem to have run out of empathy, you know? And I think that's why I keep harping on humanity and humility. There is a level of empathy that you have to tap into to maintain the strength and fortitude to stick to these things that will help people live. Literally, you're helping someone live by staying in the house. And that's more important than any haircut. I don't know how many of you have seen me before this. My nails are gone completely, and that's something that I do all the time, but I don't care. I would rather have no fingernails. I would rather have no hair. I would rather have no dresses, no cute drinks, no cocktails, whatever, if it saves lives. And I don't think that there are enough people who care that much about it, and we have to figure out how to make them care, right? How to make it. Yeah, go ahead, Kelly.
So I was going to say I think in one of the previous book discussions, I brought up the point that, in my time in government, in public service, as important as policy and legislation are, policy and legislation are not silver bullets to better living and a better life. The humanity and the compassion that you're talking about has to be fostered and nurtured in human beings. From childhood. And then as adults, we have to continue on a continuing basis to choose humanity and compassion every time we're tempted to be self-serving, etc. Especially for those of us who grew up in a society that's a lot more selfish and narcissistic focused than perhaps other societies. And so I really appreciate that point, because laws are important, policy is important, legislation is important. I am not minimizing those. I think that, those are really important tools and instruments that can provide a kind of structure and foundation for allocation of resources, for protections, for all kinds of things, accountability, blah, blah, blah. But it's really a humanity, it's a mindset, it's in the mind and the heart. And so we can't lose sight of how important that kind of work is also.
Absolutely. Yep. There was another headline that, and I have no good headlines today. None.
It's okay.
This one is from CBS News about at 3:00 this afternoon, where the latest science reports are that, and I think this is going to be really interesting for the conversation that we're having. Coronavirus is found in semen of COVID-19 survivors. Sexual transmission remains unclear, but the study is trying to make those links. So what happens if, sort of like COVID-19 becomes also recognized as an STD? And then you've got that side-by-side comparison. Although we don't need any more comparisons. I think very early on, it's the same doctor. The doctor that was vilified in the 80s is now, the country's hero. Fauci, with his involvement in, sort of like the early days of discovery of the two HIV viruses, is, now, and he tamped it down back then, and now he's the one that is the voice of reason in today's pandemic. But that was a really scary headline for me. I'm sort of like looking around at that science paper a little bit more, but boy, can you imagine? I don't know. I was.
What is it about HPV that it's like the cool STD? You know what I mean?
So you know what? It's interesting, right? So the thing is that
it's marketing.
It's marketing, exactly.
It's marketing.
It's the ability to point to a vaccine. It's the ability to say, oh, HPV may lead to cervical cancer, shrug, but it's not seen as strong as a death sentence, right? So it's like this.
And it's like, you're so cool for having sex,
it
but
just
you're
means
not
that you're
gay.
Yeah, you're out here getting around, living your life. Like, and I think there was even an episode of the show Girls on HBO where they were like, all what is it, like well-traveled women have HPV or something like that.
Yes.
Like, it's so interesting, the narrative that has developed around this. And I don't know how many people were hired to like work on the marketing. I don't know who paid who to get that line put into an HBO show, but it's really about that level of like conversation, normalization, and I guess extracting it from the like direct connection to mortality, right? Because cervical cancer can lead to death. Like I think people don't think about that, but they're like HPV, maybe cervical cancer, whatever. Like as though that's not also a very dangerous thing to be diagnosed with. And I think that I saw the same article, Nabila, and when I saw it, I was like, wow, that plus the like higher survival rate for women, it's not looking great for guys out here. Like that was the first thing I thought, right? And then I was like, well, what is this also going to mean? Because this is a new virus. This is something new that we don't know what it looks like. We don't know if it will become an STD, right? Or an STI. And then when you think about it even further, people are already working on a vaccine for it. And there's this, I think that there's this assumption or hope that there will be a vaccine developed for COVID-19. And so I think that it will likely go the route of HPV, to be honest, if it becomes one of those STI situations, but there's a vaccine. So, you know, like guys, just go get that one quick shot with your doctor and you'll be like those girls with HPV. It's the same thing, basically. Like it'll be like a lessening of concern because there's a way to put a buffer diagnosis between it and like mortality.
Yeah. Jason, I honestly, I've tried, you know, I have tried to understand the anti-vaxxers. I have tried my hardest. And you know what? Some people are just too stupid to rationalize with. I mean, the entire, you know, that it just.
I actually read an article that said that it was about the fact that science has progressed to a point where you can't understand it anymore. And so it's more comfortable to reject it. Like it's like, I actually can't understand quantum physics. So it takes like an intellectual leap to be like, I'll believe it even though I don't understand it. But it's easier to be like, I don't understand it, but I do understand something easy. You know what I mean? Like I do understand, no, that's witchcraft. Right.
Yeah.
And I've read that applied to anti-vaxxers, that really it's like when the science is too complicated to understand, a lot of people retreat to the like, it's witchcraft.
It's bizarre to me. And you know, vaccine, the thing from a cow, I mean, it's you know, it was a milkmaid that was not getting smallpox, and that is how they came up with taking, you know, a live bit of because of her contact with cows and so on. And so I find their arguments just I can't fathom them. And I do, and I want to come back to the issue of science fiction, because I love science fiction as well. I love science fiction and science fantasy. I mean, I will go there for my you know, sort of like calm reading, or my, you know, sort of like when I need to ground me. I think it should be required reading, because I think if people read, you know, sort of like some science fiction like early on, it will bring them into, you know, science reality that much better or that much easier. But
yeah, I think that I struggle with anti-vaxxers for different reasons, right? So there are people who are anti-vaxxers for their own personal reasons, and they differ. So if it's someone who is like, religion, I can't do it, my God says no, I'm not fighting you on that. I'm not going toe-to-toe with anyone's Messiah. You know what? That's you. I'm going to stay across the street. You know, that's just what it is.
Yeah. Yep.
Then there are people who are so distrusting of systems, and rightfully so, who have then spun themselves into this like space of being an anti-vaxxer. And those are the most difficult conversations that I've had, right? Because that's when I encounter people of color who are anti-vaxxers, and they're like, well, you saw what happened to Tuskegee. You saw what they did to Sarah Bartman. You see how people have been purposefully infected, not treated, and then used in studies. And I was like, you know what? I do know that. And I have nothing to disprove what you're saying. And so in those conversations, I'm like, well, I hear you, I understand, but I know enough about science, and I also don't know enough about science where I will trust the medical professionals and like listen if I'm not putting myself at some kind of serious risk. And then there are the people who are like, I will feed my child only organic food and let them roll around the dirt and they will be fine. And those are the people who I just don't even talk to about it, because it's like, if you believe that you have a special like connection with Mother Nature and your child will be fine and you don't plan on putting them in public school and all these other things, you know what? I don't even want to talk to you, because these are the same, like, in my mind, the anti-vaxxers who are like, it's my choice, it's my child, I'm going to do what I want, they're the same as the people who are trying to like threaten the states about reopening. Those are the same people who are going to governor's mansions with assault rifles, right? Like, in my mind, I put them in the same category, because there's no reasoning. Like you said, there's no reasoning with some people beyond a certain point. And I don't understand the science. The last science class I took was astronomy in college, and that's because I had to take it as a like general requirement. I have no idea what it takes to make a vaccine, but you know what? I trust that, you know, smallpox was basically eradicated. I trust that polio was basically gone. Like, I trust what the data tells me, and I'm going to go in that direction, because I'd rather not risk like contracting a middle ages level disease and like dying at 22.
Exactly. Exactly, middle ages plague. There was something that you said about the and it's a little off topic, but those parents that will let their kids just go out and roll around in the dirt. I don't find that much wrong with that, actually. I think, when we were growing up, we were out and about and, sort of like running around. I think allergies were a lot less. I grew up in a household where, sort of every day there was some form of curry. I hate that word. I hate the word curry. There's no such thing as curry, but there was some sort of curry that was cooked. So invariably, you ate a dose of turmeric a day. As a child, as a baby, as a child. And, the notion of allergies was like, they didn't exist. It just wasn't, because in your diet, you were getting enough plant inoculum, right, from different spaces, and particularly turmeric. Those allergies those antibodies and the antibody response didn't get a chance to build up when you were a baby. And so as you grew up, they didn't become full-blown allergies. And here we are now, where we've made our environment so aseptic and so clean that, we're coming back to needing to introduce these things back into our diet. Having to go and buy turmeric pills so that you can have a less of an inflammatory response is absurd to me. It's just that anyway. But it's a little off topic, but still kind of healthcare related.
No, I totally agree with you. I totally agree with you. It's very much connected, right? I was a kid that made mud pies and got in trouble for using my grandmother's good cookware to make mud pies. And I played in the dirt, and I'm sure that there are all kinds of things that most parents would think were terrible, but I'm fine. I don't get sick much, but I also got vaccinated, right? Like, it's the people who are like, roll around the dirt and so you don't ever need the vaccines. I'm down to do both. I believe in both sides of it, right? I get migraines, and so on one side I have like my like piercing that is supposed to be on a certain pressure point to help relieve migraines, and then I also have a prescription for medication to take when that migraine still comes through. Like, I take both, take the good from both.
Yep,
anti-vaxxers are weird because they have a very, very small voice, but they benefit from society because we're all like vaccinated. So even though they're running around susceptible to these diseases, they're not getting them because society did the work for them.
Right.
So somehow
Yes.
they think they're right. And it's just that all of
Yeah,
us
that's a
got
good
the
point.
vaccine.
That's a good point. And unfortunately, though some diseases that had been nearly eradicated are supposedly re-emerging now,
My God.
because there are some, because there's, yeah.
Tuberculosis. My brother, like last year, the entire tribe of his, his wife's entire tribe, that side of the family, they went to Italy as a group, as a family holiday. In September, they went to Italy. I see him like 6 weeks later in October, and I'm like, okay, what is going on? How is it that you've dropped all this weight? And we couldn't figure out what was going on, what was wrong with him. It turns out that, sort of like, it could only have been a couple of things. And I was very, very worried that it was going to be Hodgkin's lymphoma, because that, the symptoms looked like that. It turns out that while in Italy, he had been exposed to tuberculosis. And as a 50-year-old man, he ended up with TB. And so here he is now it's going to take him a year of, antibiotic therapy, like heavy duty, broad spectrum antibiotics to get rid of this infection. So there is, sort of like those diseases are coming back, and they're coming back because we're not really following the instructions all the way through. And we're not, sort of like, particularly when it comes to antibiotic treatments, unless if you don't take the full course of antibiotic, that bacteria is going to mutate and is going to become multi-drug resistant. And the minute that it becomes multi-drug resistant, it becomes impossible to treat. And then what you end up with is you don't end up with that herd immunity protection anymore, and you end up, sort of succumbing the way Harry did. But it's interesting to see those diseases that we thought were completely gone re-emerge, and they are re-emerging in, again, those socioeconomic. Again, there's a direct parallel with the socioeconomic class and how those diseases are emerging. I mean, TB before, like 2 years ago, there was a very big discussion of the hotspots, the hotspots of tuberculosis in Chicago, and there are. I mean, sort of like in particularly in Southside, particularly, sort of like mostly Southside is where I'd heard it, and in our African American communities. So it's scary. Those diseases coming back up. To me, it's a very scary thought.
And Sonal, actually, in the chat room, actually, Sonal, did you want to bring your question forward in terms of, the question, and Jason responded, the question about whether or not there's a character that kind of has an anti-vaccine point of view, and there actually are people in the friend circle who talked about that. So no pressure. If you wanted to bring your question forward, you're more than welcome to, in terms of the book and the characters.
Well, because then in terms of how a character like that, where it's like, I mean, the gay community at least like it was championed for empathy and for like feeling feelings, and this is a safe space to feel feelings. And then it's so complicated because it's like you want to be celebratory and you want to be, hanging out. And then it's like, there was a lot of paranoia and discussion too, that it was like you were putting yourself on a government list, right? If you got the antibody test. So it's just really difficult to navigate, like your own wanting to feel good and happy and be surrounded by friends, and also even like airing an opinion, like, is this antibody test real, or is this vaccine test real? Because then it sounds like you have such a lack of empathy. So I was wondering if there wasn't really like a main in the book, but yeah, Teddy, what was up with Roman?
I think, oh God, what that Roman, you know, and I know I'm really happy to carry this on. I know we're at 6:35. Roman, we haven't even touched on Roman. I mean, again, the shame and the you know, so he was a Mormon, right? Mm-hmm. And he came from this one particular community, and his, I felt so sorry for him, and I tried to hold his experience with sympathy and with love, but honestly it took a lot for me not to be, oh maybe that's in next week's, it might be in next week's reading. It took a lot for me to be not disgusted with him. There was a time, there's a part where I get real angry with him. Really,
I don't think we're at that part yet. So far, he's just been like distant over what happened in Wisconsin. And I haven't read ahead, so I don't know.
Sorry, Jason. I did that before as well.
Yes, Heather.
Yes, Heather. Heather asked a question, is Roman the intern? And yes, Roman is the intern.
Okay, because that's very, I mean, you know, for some foreshadowing, the way that we withhold information because we don't want to make other people uncomfortable. You know, where it's like, I mean, the topic of consent is very new. It's brand new.
You know? Yeah.
So, yeah, I mean, we can hold that till next week too. Yeah.
Yeah, I think that is going to be bring it up early next week, because I think that is it'll sit better with next week's reading.
But it's funny, like the title of the book is there is like a conversation in the book so much around not wanting to know your status. The government's going to use it to it's going to be used to your detriment by the government, and it's like, I wonder about the title, like Great Believers, like what does it exactly mean? Like they want to just believe they're going to be okay or something, like eventually, like inevitably you have to know your status, because if you're sick and it's going to affect you. But it's the opposite now, because if we could know our COVID status, we could go out and play, you know? Well, if we had COVID, we wouldn't go out and play, but if we could know that we didn't. Sorry, I don't want to sound like a protester.
Yeah, it is a quote, and I was trying to find it, and I think it is was it an F. Scott Fitz? Yeah, that's it. So it fits in. It's F. Scott Fitzgerald, and it's right at the beginning, where it's from My Generation, and it is, we were the great believers. I have never cared for any men as much as for these who felt the first springs when I did, and who saw death ahead and were reprieved, and who now walk the long stormy summer. So that's it. So that's it's more about that generation. It's more about and you know, we can ask Rebecca during the last week as to why she picked that, but I think it's an apt quote. Yes, I think. Oh, Heather, yes, it is. It's right at the beginning. It's a quote from My Generation.
I didn't know that. I listened to the audiobook, and I don't think it had it in the. But now I get it.
No, it's in the. Yeah, it's in the front. You know the front dedication. Yep. So would that be? Jason asks. So would that be another parallel to the World War I and Spanish flu? I would. Yeah, I would think so. The two wars, one of the things that I say about both World War I and World War II, again, growing up in England in being born in the 60s and growing up in the 70s, it was a country that lost 2 generations of men. So you've got, World War One, the war to end all wars. Sort of an entire generation of young men are, sort of like lost. And then just as the children that were babies during World War One are growing up to be, sort of active members of different communities and being out again, in their 20s, you end up with World War Two. And again, you get another generation that gets cut down and is decimated. And I think that the psyche of the British, certainly when I was growing up, was very much with that, sort of like, with that idea that the potential of that country had been lost. And so what it did to replace it was to bring in the BAME community, so the Black, Asian, and minority ethnicities. And it is those communities that have now grown up and have got second generation kids that are, sort of claiming the country as their own and really not being accepted by, sort of like by the traditional white community in that country. That's a whole other like side discussion. But the BAME community in Britain and the Black and Latinx community in the United States, there are so many parallels. It's really interesting.
That could be a podcast in and of itself.
Yeah. We should think about maybe doing something along those lines. I know we're
absolutely.
Yeah.
Yes.
This generation were the ones.
It's time that we close down.
Yeah, that could be another book. You're right, Jason. Okay. That could be another book.
It could totally be another book. This was.
Thank you so much. Yeah. Sorry. Go ahead, Kelly.
So I just wanted to feel free to chime in. I just wanted to thank everyone for joining us. Thank you, book clubbers. Thank you so much again, Aisha, for joining us. This was just a great discussion. I really appreciated the wonderful kind of context that you provided for our conversation, and many of the points that you raised around race and stigma and community and systemic structures and institutions, as well as humanity, all of these things, because it's all a part of how we sort of live our lives, how we create community, how we battle and how we handle not only pandemics, but other types of social ills in our society. So your contributions were so valuable. And let's see, I just want to remind everyone before I turn it over to Nabila, in case you have anything you'd like to share, Nabila. Our next book club session is next Thursday, May 14th, and we will be reading pages 279 to 355. So those are the pages, again, 279 to 355. And we'd love it if you could fill out a brief survey. And feel free to send in your recommendations for future book club books. So if you look in the chat room, there's a link actually to complete that survey. So again, thank you so much. Nabila, did you want to share anything?
So next week, our guest next week is Devin?
That will be announced soon. So stay tuned.
stay tuned for that. Our guest during the last week is going to be the author. So next week we are going up to page 355, and then the week after, on the 21st, we're going to finish the book, so that during the last week we have a full discussion with Rebecca, which I'm really looking forward to. I think it's going to be great. Thank you all very much. And
exciting. Thank you.
See you next. All right.
Thank you.
Aisha. Bye, everyone. Bye, book lovers.
Take care.